Yes, get ready. Dr. Helen Sands. So, here we are. So, this is an interview. Patients who are learning to cope with amputation. You have 90 seconds. And the questions are 31 to 36. Now, let us go through these questions. This is the first question, 31. Now, I'll show you how to isolate the questions from a lecture. Okay. I'll tell you how to isolate the questions from a lecture because these are called the dividers, the separators. How to identify that the question is gone and another question has come. It's very important. Yeah. Here you can see the subject of this question is David. David. So how the topic changes, that we have to see here. And here David. And here is missing, or we call as phantom limb. Right. And this is missing limb, still attached. Okay. And here trial, treatment trial. Treatment trial. Okay. Here treatment trial, patients are. Okay. And one advantage one advantage. So this is how we segregate the topics. Dr. Helen Sands. Listening part C, lecture session. So we have one more letter. We'll do that one later. Dr. Helen Sands. This is related to amputation and how the patients cope with amputation. This is the question number 31. Just have a rough idea. Then we are going to the next two questions, 32 and 33. Then question number 34 and 35. And 36. Yes. Yes. This is 31st question. We'll see question by question how it changes. Go through this question, how to identify the technicalities. Study this question. First thing is, we have a young patient, okay, called David. David is important here. David is important here. And what is David's reaction to the amputation of the entire story is about amputation. So David's reaction. David's reaction. Reaction is important. David's reaction. Okay. He felt he was now excluded from normal life. Is it talking about life, normal life? Life. The point is life. Is he talking about life, normal life, excluded from normal life? So he's talking about general life, life, that's all. And second one, he compared it to the experience of a relative dying, relative. Is he relating to a relative's death? Relative in the family and his death. He resented his inability to take part in physical activities. So this is related to activities. Activities. Okay. Relating to activities. Yeah. So is he worried about normal life, or is he comparing it to relatives of death, or is he talking about physical activities that he's not able to? Resented means felt sad, feel upset, feel upset. Think about this. Try to identify. Okay, this is one style of analyzing the question. This is one style of analyzing the question. And the second style of analyzing the question is his feelings. Okay, his feelings. Second style, his feelings. And here it is a comparison. And here it is his worry. His worry. First one is feelings. Second one is comparison. Third one is resentment. That means feeling upset, worry. Okay. So this is another comparison. Take that one or this one. Any one you take. Okay. So answers may come. Okay. Answers may come. Now you have to find out this one, but these particular things. Focused on these particular things. Then it will be easy for you to identify. Yes. Now focus on this particular area. Focus on this particular area. Reaction. Reaction to life, or reaction comparison with relatives' death, and reaction regarding his inability to participate in physical activities. So is he talking about life itself, or is he talking about somebody else, a relative, or is he talking about physical activities? Okay, or is it his feelings or comparison or resentment? Anyone you can take there. So both these things you can be confident.
Occupational English test. Listening test.
Or does something sudden like an accident, a limb in combat, it's large numbers.
And I understand that you have a treatment trial going on.
That affects a number of brain functions. They reported that as a result, their pain diminished.
So the treatment was useful.
And within a month. Thinking about it, though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
Yeah, if your body's hurting, it's telling you something.
Okay.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with Dr. Helen Sands about her work with patients who are learning to cope with amputation. You now have 90 seconds to read questions 31 to 36.
I'm joined today by Dr. Helen Sands, who works with patients who've had limbs amputated. Now, amputation is an extremely traumatic experience for patients. Helen, in your experience, how do younger patients tend to react to it?
Well, in a range of ways, depending on whether the loss was expected, if it was due to chronic illness, or to something sudden like an accident. One of my young patients in that situation, let's call him David, said losing his leg suddenly was like the pain of an unexpected death in the family. And although this didn't really apply to him, for many young people, even watching a football game can make them feel shut out of activities they once took for granted. But then others come to terms with the fact that for them, normality will be something different from what it was before the operation.
And patients can still suffer pain from a missing limb, can't they, even after the limb's been amputated? What's called phantom limb syndrome.
Yes. So, get ready, all of you. Question 31. Question 31. Yes. 7, 6, 5, 4, 3, 2, 1, and submit your answer. Submit your answer. Yes. Question 31. Yes. That is question 31. Yes. So you have already given the answer, right? So pause and share. I'm feeding the answer here. Create poll. A, B, and C. Yeah. So question number 31. Yes. Resume share. So you have given the answers, right? Now what I'm doing is copy post link, and I'm giving you the point here. So you can check your answer there. Copy message link, either places. So you can just click on the link and you can pick on A, B, or C, whatever answer you have written. So one person has already got here. 3 people. Very good. Right. Fine. Yes. That's the point there. Now submit your scores. Yeah. Submit your scores 1 by 1 or 0 by 1. Yeah. 8 answers. Good. 8 answers. Good. Now let us see how this question relates. A comparative study. Okay. For making a comparative study. This normally no one gives like that, but it is not our problem. Our problem is to find how differently we can learn. How differently we can learn, that is the important aspect. Now let us see. Yeah, now that I have taken here. Now our study is something different. We don't like to study like normal people. Okay, we should find why it is right and why it is wrong. I hope you understand. So we'll make this listening text as a reading text. Let me see. Let me show you. Now here, I already told you, we study differently. We study in a different manner. So I'll take the audio script for this. So yeah, here it is. Here it is. So we don't bother about the man, but female, Dr. Helen Sands. So this is the point for us. So let us take this one. I'm trying to do my level best. Bear with me. I'm trying to do my level best. Just bear with me. Yes. Now we made this listening into reading. We made this listening into a reading style. Now let us see here. David. Okay. Let us take it like that. How to identify this and how the question comes. David and young patient. Young patient. Young. That means you can see here. So the question is by a male person. So here you see younger patients. So patients only. So no need. That is not important here. Younger patients. Everyone is a patient here. All are patients. But here younger patient. The word young is important. So in the question, you have to relate. When he says young, that means you have to understand how it goes. The question starts with young. And the answer starts with an example giving David. So this is how you have to relate. And this is a pseudonym, false name. Okay, it's a false name, imaginary name. Let's call him. That means the patient's real name is not explained here. The patient's real name is not told. Okay, David. Okay. So that is how you have to relate here. So next, and this patient is young. One of my young patients. This is the point. Young. Okay. Young. Now here I'm going to give you a concept which many people, 70 to 75, sorry, 75% of the people give wrong grammar here. I'm teaching you a concept in speaking. I'm teaching you a concept in writing. Okay. Many people don't know how to use this phrase. Many people do not know how to use this phrase. Right. But I'm going to explain you here the concept. I'm going to explain you the concept. Very, very special concept, which many of you use in speaking, but you make blunders of it. At least learn from here. I tell you, listen, listen, listen. Never you people take the script and listen to the audio like this. Every time, how many times I told the students? I told a number of times. Take the question paper and go through these things like this. But we don't mind. Okay. Now here, many people say, I am Sunayana, one of the registered nurse. One of the registered nurse. Okay, one of the registered nurse. Now, one of my young patient or patients. This is called singular plural concept. This is a singular plural concept. Please don't send personal messages to me, please. Send it to everyone. Okay. Nobody should send personal messages to me, please. Every time I have to change to personal to everyone, then it will be difficult for me. So this is a concept. The concept, okay? The concept. What is the concept? One of many, or one among many. One among many. You have to remember that. One among many. You should remember that very clearly. Okay. One of my young patients. One of my young patients. You think I am mad to tell you to learn these concepts? Huh? Why I tell you to learn these things? Okay. Okay, Kale, no problem. Carry on. You're a doctor. You have to attend the call. I can understand. Now, can you give an example? I am one of the registered nurses. One of the registered nurses. I have given you one concept, one example. Concept is one of the many. Okay. One of the many. Can I edit this one? Okay. One of the many. One of the many. One of the all, many. One of the many. There are many, and out of them one. This is a concept. This is a concept. Can you write one like this one? My name is Abraham Link, one of my friends, Rajeshwari Ram Sarvegar, one of my friends. Very good, Srija Ravindran. Very good. Can you expand that one? Hari is one of my friends. Like that. I am. Okay. First you write like this only. Afterwards we can expand that one. One of my friends. One of my friends. I am one of the registered nurses. Like that. Okay. Concept. You learn a lot of concepts in listening and reading. If you go through them, you can learn a lot of concepts. Yeah. Come on, give me your examples. I studied in one of the reputed organizations. One of the reputed organizations. Yes. So, Mr. Peter, one, Mr. Srija, one is mad. Where is the full stop? Srija Ravindran, where is the full stop? I'll find mistakes like that, okay? My name is Simon, I am not Peter, okay? Right, Mr. Peter is one of the best teachers. Full stop. Where is your full stop? Rewrite it with the proper full stop. Yes, everything is important. Should be perfect. Should be perfect. Next, come on, give your examples fast. Give your examples first. I have worked in one of the well-reputed organizations. Wow, Priya Chinnaswamy. Huh? Is this Priya Chinnaswamy? Yes, sir. So I will correct your sentence. Well-reputed, well-reputed. Well-reputed is one compound noun. One compound word. Well-reputed. You have to write like this. Well-reputed. Like this. Rewrite with the corrections, please. Yeah. I have worked in one of the well-reputed organizations. Very good. My daughter is one of the best students in the class. Very good. Come on, you're coming. Priya, I did not want, I want a full sentence with well-reputed. That's it. And hyphen, there should not be a space in between. It should be attached. It should be attached. Come on, we are learning concepts. Okay. Mr. Lincoln is one of the best doctors in Trivandrum. Mr. Lincoln, Mr. Abraham Lincoln, I don't know why I like Abraham Lincoln. Mr. Abraham Lincoln is one of the best doctors in Trivandrum. Mr. Abraham Lincoln is one of the best doctors in Trivandrum. Medication compliance is one of the best strategies to deal with chronic diseases. See, I brought one wonderful sentence. I have written one of the best sentences. Medication compliance is one of the best strategies to deal with chronic diseases. You can use in your speaking. You can use in your writing. You can use in your, yeah. I have seen one of the best institutions in Karnataka. Who is this? Rajeshwari. Karnataka should be written K capital letter. Rajeshwari. Very bad, Simon sir. What to do? Yeah. Yes, that is what I'm waiting for. Karnataka with a capital K. That's awesome. You're very obedient. Come on, everyone, write one sentence. Nah? One of the many. Injection. Priya, injection. Enoxaparin. Is it a brand name? Then capital letter. An injection, right? Full, no? Is one of the best anticoagulants. Fine. Injection. Don't write short forms. Write in full. When you speak, do you say enoxaparin? When you write, you say enoxaparin, or injection you'll write. Right. And enoxaparin. Is it a brand name or a generic name? Muthu Lakshmi, spelling problem. You made a mistake, Muthu Lakshmi. Correct it. You made a mistake there. So, Cambridge Dictionary. Not Cambridge Dictionary. general. Enoxaparin. Brand name, brand or generic name. Yeah, enoxaparin, not enoxaparin, enoxaparin. So you wrote a spelling mistake. You wrote a spelling mistake. So this is the spelling. This is the spelling, please. Okay. Enoxaparin is marketed under the brand name Lovenox and as a generic drug under the name enoxaparin. It's a generic. Two mistakes you have made. Two mistakes you have made. Who is this? Priya Chinnaswamy. Priya Chinnaswamy. You have made two mistakes. First one is you are not supposed to write a capital letter for generic names. Generic drug, enoxaparin. This is enoxaparin sodium. That is generic name. And the brand name is Lovenox. Brand name is Lovenox. So this is a generic name. This is a generic name. It is, I don't know. I don't know. I'm not specialist. See here, generic enoxaparin, Food and Drug Administration by government. This is a government website. Food and Drug Administration. Which government, I don't know. But it's a government website. What are the other brands of enoxaparin? See, small letter. Small letter. Okay, small letter. See this. So he's asking, what are the other brand names of enoxaparin? One is Lovenox, brand name L capital letter, but enoxaparin is small letter. Number one mistake. And spelling is E-N-O, not E-N-A. So two spelling mistakes you have done. That's it. So we cannot say it is brand name. Okay, according to what this is telling. Okay, right. Clexane is brand name. Lonopin is brand name. Enclex is brand name. LMWX is brand name. Womanox is brand name. Enoxaparin is brand name. Lupinox is brand name. Loparin is brand name. And there are more items also, we don't mind. But enoxaparin is a generic name. Okay, that's it. I don't know. Don't ask me many other things. Okay, I don't know. I'm a novice in this regard. Okay, I am one of the students of Mr. Simon. Okay, I am one of the Mr. Simon students. Okay, full stop. Samyat. Simyat. Hotel Hyatt is one of the best hotels in Nepal. Very good. I have been working in one of the best hospitals in Kuwait for the last 10 years. Very good. 100% correct sentence. No mistake. I have been working in one of the best hotels in Kuwait. Yes. That's good. Very good. That's really fine. Right. So that is how it is. Now, okay. Right. So David. David. So the person who is questioning doesn't know who is David. He doesn't even know anything about David. He's talking about the young patients. He's asking, what about how do younger patients deal with this? Younger patients. Then he gave one of my young patients. One of my young patients. Let's call him David. That means he is not David. His name is something else, but let us call him David. He is not David. It's a pseudonym. Pseudonym means false name. False name. Because they don't want to reveal the patient's identity. They do not want to reveal the patient's identity. Yeah. Right. That's very clear. Now I told you the points there. Okay. It is regarding life, or is it regarding relative or death? First one is life, second one is death, and third one is activities. Life, death, activities, or dying activities. Okay, relative. And these are activities. First one is life. Okay, about himself. Second one is about others. Third one is about his activities. Now, if you see, one of my young patients in that situation, let's call him David, in brackets, okay, said losing his leg, losing, coming to the point here, okay, losing, amputation, his leg, reacted, said, he reacted, said, reacted in oral reaction. So this is how you relate, how the words are linked. You will not hear the same words. There are three types of relationships. His leg, losing means amputation, said means reaction. So here it is. The answer will come next in the same sentence. In the same sentence. In the same sentence. Same words will not be there. Same words will not be there. Now what I am doing, see here very carefully. I am blindfolding because the other things are unnecessary. The other things are unnecessary. Right? So here the answer will not be there because it is a question asked by somebody. The answer only you will get. Okay. Answer will be given by expert, not the interviewer. All right. And the sentence starts from one of my younger. So this is not important. Answer will not be here. Answer will not be here. Then answer ends, sentence ends here. Sentence ends here. Okay. So answer will not be here also. And this is, I don't know how you are going to take it. Take it or leave it. That is your right. Answer is there. Answer is there. The words are twisted. The words are twisted, battered. They are spoiled. They are hidden. They are covered. Okay. So they are made to be difficult. They are made to be complicated. You have to crack this shell. Now let us see the words. The first part is done. One of my young patients in that situation, let's call him David. That is in the question part. Now let us separate this one. That is the question part. The first part is the question part. Let's halt in David till there. Afterwards, the question part in first half, the answer part in the second half. David reacted, losing his leg. Suddenly, was like. Every word you should identify. Every word you must identify. What do you mean by like? Do you know what is like? Like means he is tall like a coconut tree. That means you are comparing him to a coconut tree. You are comparing him to a coconut tree. He is tall like the coconut tree. He is strong like a mountain. He fights like a lion. You should get goosebumps. Otherwise, that means you are not learning. Entire body, okay, should receive your knowledge. Okay. Like means compares. Like means compares. Okay. Like means compares. He said, David said, who is he? He is David. He is David. Compared. It means losing his leg suddenly. Amputation of his leg. Comparing amputation of his leg. It means what? It means amputation. The amputation of his leg is it. He compared that it was like. Amputation of his leg was like. Losing his leg was like. It means what? Amputation of his leg. It refers to what? It refers to what? It refers to amputation of his leg. Many questions you will get. Many questions you will get. Yeah. Yes. So, try to understand the power of the words. Try to understand the power of the words. Don't learn 100 questions. Learn, okay. You have to tell me. You have to tell me your points. Very good. Participation is there. Sukhvinder, wonderful. Srija Ravinder, wonderful. I'll give a word. You have to relate it to me. You have to relate it to me. Yes. You have to. Right. Yeah. Here it is. Reaction. Instead. Okay. Amputation means losing his leg. His leg. Right. One of my young patients is David. Okay. It means amputation of the leg. It means losing his leg. Compared means like. Many people think, what are all these lines? Yeah, those are the lines you can see. If you cannot realize this, here you are able to see, but your mind should see. I don't draw, but still your mind should see. Okay. He, who is he? One of my young patients. Who is he? David. David, one of my young patients. He compared it to what? To what? Yeah. Like the pain of an unexpected death. Death means dying. In the family means unexpected death in the family. In the family means family members. Family member is a relative. Do you think he will say the word relative? Is he crazy? No. Remember this very carefully. Remember this very carefully. He will not use the same words. That's the point there. So now, death, dying, relative, a relative, a relative, the family. Family means death in the family means death of a person in the family means a relative. Family member is a relative. It's okay. The experience, the experience, the experience, the experience, experience. You experience pain. Pain is an experience. Pain is an experience. Okay, of. That's it. Can't you see each and everything there? Right? In the question, everything should be there in the passage. But in the passage, everything need not be in the question. Remember that. What all is there in the question must be there in the passage. What is there? For example, suddenly is there in the passage. Suddenly need not be there in the question. Unexpected is there in the passage. It need not be there. But whatever is there in the question, option B must be there in the passage. But sir, here in the passage, suddenly is there. But in the question, he did not ask regarding suddenly or not, no? So there is no problem. If the question is there, suddenly, then definitely the suddenly also should be there. Remember that. So I hope you can understand the point here. You can understand the point here. Yes, I feel proud of you because you are patiently listening. Because you are listening, I am able to explain. Okay, it empowers me because you are ready to learn. So I am learning before well in advance to teach you. Okay, because somebody is ready to purchase from me, buy from me, learn from me, experience from me all this wisdom. So I am increasing my wisdom so that I can guide you properly. If you are not ready to listen, then how can I? What is the need for me to learn? So that's why you are the reason for all these things. Yeah. Hide, floating. That's it. You have to identify these things, the secrets. If it is an interview, the answer will be from the interviewee, not from the interviewer. That means who is asking questions, you will not get the answer. Who is answering the question, you will get the answer. That's it. That is from the female voice, Helen Sands. Helen Sands is answering the questions because she is the authority over the subject. The interviewer is just asking because he wants to know. He wants the world to know. So he's asking questions, and the interviewee, the authority over the subject, is answering. Everyone can have questions, but answers can be had only by an expert. Many people ask me, sir, explain part C, explain part C, explain part C. So that is how we'll follow it up. If you are an expert, then only you can explain. If you are not an expert, you cannot explain. So you should go to an expert to find out the answers. Okay? Don't go to every person and ask, what is this? They cannot give you. So go only to an expert, he will give you the answers. So who is the expert here? Here, this male person is a novice. He doesn't know anything. He doesn't know anything. He's only asking questions. He's just asking questions. He's just asking questions. Anybody can ask these questions, but answers, okay, is given by the expert, authority over the subject. That's it. Right. See, for example, if anybody asks a nurse, what should I do, nurse? They say, I don't know, sorry, I am not the authority over the subject. I am not the authorized personnel. So I will inform the doctor. You can meet the doctor. I'll provide an appointment for you. You can discuss with the doctor. He will give you all the relevant information. This is what you are going to say. That's it. Nine answers. That's it. Nothing is there in that. But how to isolate the answer? Because many students have given the wrong answer there. Okay. I made it reading now. Listening is transformed into reading. Listening test is transformed into reading, as you can see there. Just see that. So this is the reading text, and that is the question. Learn differently. Okay. Winners do not do different things, but they do things differently. Why I am able to win the hearts of these students who are on my platform? There are many students who are telling, sir, we are following you, sir. After 1 year, now I am registering with you, sir. I have seen many things. I tried many things, sir, but now I want to join you, sir, because I feel your way is correct. Earlier, I did not know, sir, but I tried all these things, but now I know that yours is the right way. And many students who tell like that. Winners don't do different things. They also do the same things, but they do things differently. Okay. We are not doing listening now. We are doing reading now. Listening is transformed into a reading style. Okay. That's it. Sir, where is the audio, sir? That audio anybody can do anywhere. But these things which I am giving you here, see, without the audio also people can find the answer. That's it. One question, solid explanation. That's enough. No need of 100 of examinations. So 2 seats. Yesterday I told you 4 nurses and 2 doctors. 2 nurses have registered. 2 more nurses are places are available, and 2 doctors places are still available. If anybody is interested, you can contact me. One doctor from Pakistan was asking me, so maybe that will be confirmed. If that is confirmed, then another only one will be there. Right. Yeah. So this is the question here. Now, right. That is question number 31. Now we have question number 32. Question number 32. But before going to the question number 32, what I want you to do is, okay, what I want you to do is, do me a favor. I don't know whether I am going in the right direction or not. For your purpose, I know what I am doing. I know practically what I am doing. There is no question regarding that one for myself. But how do you feel regarding this? What are your comments? Do you think that you deserve, okay, these things, or you don't need these things? If you are facing lot of difficulty, then you say you deserve these things. If you are an expert, you don't need these things. Okay. If you're an expert, you don't need these things. If you are facing difficulty in learning these things, then you can tell me, yes, sir, what you have explained, this is fine, sir, this is easy for us. So give me more of these sessions, sir, because I take time. Okay. So, or you want me to rush past it, just to give the questions and give the answers. Okay. Give the question paper and give the answer paper. Finish, we will do, sir. That also is possible. There are many students who take like that. There are many students who ask like that. Yes, I'm giving you 1 minute to tell me, okay, give your judgment on the work this platform is doing. Give me your judgment whether this platform is doing what you need. Is it meeting your requirements or not? Is it meeting your requirements or not? So you have to tell me that one, whether it is meeting your requirements or not. Yeah. Share your experience, please. Because we are doing we are going to start a offline class. Already started. Student is coming from Bangalore all the way. 16, hours journey. He's on the way. They're coming and joining. And I want to tell you one thing. Our license is approved. Our license is approved, and we are going to start these sessions. We are going to start the classes, offline classes. I was waiting. They gave us permission to start, but I said no. Once everything is done, then only we waited, and things are going on. Just give your comments whether we are doing right or not. We don't need this much, sir. This is waste of our time. So just give us our questions and we'll learn. Or you tell me, sir, give us more explanation also. I'm ready for that one. Yeah. Just 30 more seconds. Everyone share openly. Whatever you feel, share openly. Because based on your judgment, based on your words, I'll give you more and more. No problem. If not 1 hour, I'll give you 2 hours, 3 hours, no problem. Instead of one example, I'll give you 2 examples, 3 examples. That's not a problem for me. Remember, because of you, my name spreads far and wide. Yes. So, yeah, right. So 15 seconds more. So we are moving to the next question. So just to give your comments, shall we move on to the next question? If you are clear enough, if you understood everything, then tell me yes. Otherwise, if you have any doubts, you can still ask me. Yeah. Right. Give me your suggestion. Can we move on to the next question? Give me a yes. Give me a yes, please. Those who are interested to move on to the next question, give me a yes. Yeah, this is the next question. Now let us study this question. We're not reading. Many people say reading, reading test, reading. This is not a reading test. This is a study text, a survey, research. Okay. This is a research. This is a survey. This is an exploration. Okay. This is a study of the subject. Don't think it is a reading. Just if you read, you'll get an answer. No, that's utter nonsense. Okay. This is in-depth study. What does Dr. Sandra suggest? Dr. Sands suggest about pain in a missing or pain in missing or phantom limb. What does Dr. Sands suggest about pain in missing or phantom limb? Okay, what does Dr. Sands suggest about pain in a missing or phantom limb? So here the most important word is phantom. The most important word is phantom. You can see the inverted comma on both the sides, inverted commas. That means it is very, very important. Right. Now here you can notice, what does Dr. Sands suggest about pain in a missing or phantom limb? Okay. So the main word is important. So the two words which are very important is underreporting and frequency. Underreporting and frequency of pain. Underreporting. Pain is there, but you did not report it properly. Many people don't report the doctors. Many people do not report the doctors. Okay. Many people do not report to the doctors. So because of that, okay, she is suggesting patients should report. Then it will be easy to know the frequency. But people are not reporting. If they are not reporting, how will we know? It will be difficult for us to diagnose, identify the frequency of pain. They get pain. If they get 10 times pain, they will explain one time only when it is unbearable. If it is bearable, means they will bear. Try to understand the point there. Pain only when it is unbearable, you will explain. Okay, normal pain only, no problem. Severe pain, then you will go into the doctor. So severe pain is coming where they're coming to the doctor. They're telling the doctor. But pain, lightly it is there. Okay, we'll see. If it is too much pain, then we'll go to the doctor. So one day he gets pain, normal pain. So he'll not go to the doctor. On the 7th day, he's getting severe pain. Then he's going to the doctor. So out of 7 times, he's telling one time. So how do we know the frequency of pain? Intensity of pain you are knowing, serious. Then only you doctor is knowing. Then non-serious pain, you have to tell, today is less, tomorrow will be more. After 5 days, it will be the most. So if you tell now only, we can do something. Nah? That intensity will not come in the future, right? So how many times it is coming? We cannot know. So people are not reporting properly. They are reporting lesser number of times than they actually have to report. Okay. That's it. So that's why it is making us hard. Okay. To know how the frequency, the number of times you are facing this pain. Okay. Next one. Next one is the discomfort, uneasiness, discomfort, uncomfortable, uneasiness, lack of ease. Synonyms. Discomfort can generally be traced to a physical cause. A physical cause. Reason. If you are facing a discomfort, then we can find out what is causing it. Maybe your position, maybe your angle, maybe your movement, maybe your speed of walk, movement, maybe sudden movements, or when you are getting up and when you are lying down. So there is a physical cause behind it. So if you are lying, then you get the pain in the leg. When you are walking, when you are running, you are getting. So there's a cause. Running is the cause for that discomfort. When you run, you get the pain. Okay. When you suddenly twist, you get the pain. So what is the reason behind this discomfort? Okay. The next one. The problem affects far few patients now than in the past. So this is comparison. This is in the past and now fewer than. Earlier there were more. Than. After than is past. So before than is present. Fewer than present means more than the past. Now, in the present, fewer. In the past, more. Try to understand this. So this is talking about statistics, the figures, the numbers, the data, the value, the ratio, the proportion. How many? Okay. More than, lesser than. Earlier they were more than now. Now they are fewer than the past. So when you're saying past comparison with present, that means the problem affects less now. In the past it was more, but now it is less. So this is comparison. Second one is discomfort. First one is under-reporting, not properly reporting. Informing the doctor is the problem first. Second one, there is a reason behind it. Third one is statistics. First one is about the patients not telling information. First one is about the information. Second one is the reason behind it. And the third one is the comparison. First one is reporting, information passing on to the authority. Information from the patient to the doctor. That information is not moving forward. Okay. Problem with information. Information is not reaching the doctor. Second one is reason. There is a reason behind it. Because of that reason, there is a discomfort. So reason behind this discomfort. And third one is, earlier there were more patients affected. Earlier this pain affected more, but now this pain affects less number of people. So this is statistics. This is statistics. So I hope you understand. Information passed down to the doctors. Reason behind this discomfort. Comparison between past and future regarding the number of patients suffering is decreasing. Earlier more, now less. That is comparison. More than, lesser than, fewer than, comparison. So try to understand this comparison very clear. Okay. Pain in the past and pain in the present. C. Pain is because of a cause. B. Pain is not reported properly. A. Try to understand this. Pain is not reported. Pain is not reported. Okay. The cause of the pain, which is leading to discomfort, the cause, the physical cause, the reason. Third one is the figures are coming down, the statistics. Earlier there were more statistics, values. How many patients are suffering? Earlier more, now less. The decreasing trend of the patient. Trend, it can be termed as a trend, decreasing trend. From the past to the present, earlier 10 people were suffering, now 5 people are suffering. So decreasing trend of the statistics. Sufferers became less now. Don't know the reason behind it. Sufferers earlier were more, now they are less. So try to analyze the question in this manner. If you analyze these questions like this every day, 10 questions, within 10 days, you will become an expert. You don't need Simon Sir anymore. Okay? You don't need Simon Sir anymore. That's the point. Now let us see here. Yeah. Pain is not reported, under-reported, not properly reported. Reported but not properly reported. Instead of 10 times, 1 time reported. Under-reported. Okay? Under-reported. The next one. Pain. The reason behind this pain. The cause. Okay? The cause. Pain in the past was more. Pain is becoming lesser. Fewer number of patients. So past and present comparison, fewer patients, statistics. Statistics. Try to understand. Focus on these 3 words. Reporting correctly or not correctly, incorrectly, inappropriately. Second one is reason, cause. Okay. Then how many patients? That is C. How many patients? That is C. Yes, now we are going to listen to the audio.
I'm joined today by Dr. Helen Sands, who works with patients who've had limbs amputated. Now, amputation is an extremely traumatic experience for patients. Helen, in your experience, how do younger patients tend to react to it?
Well, in a range of ways, depending on whether the loss was expected, if it was due to chronic illness, or to something sudden like an accident. One of my young patients in that situation, let's call him David, said losing his leg suddenly was like the pain of an unexpected death in the family. And although this didn't really apply to him, for many young people, even watching a football game can make them feel shut out of activities they once took for granted. But then others come to terms with the fact that for them, normality will be something different from what it was before the operation.
And patients can still suffer pain from a missing limb, can't they, even after the limb's been amputated? What's called phantom limb syndrome. How common is this?
Well, the phenomenon was first observed many years ago in soldiers who'd lost a limb in combat. The majority reported pain coming from the missing limb. Obviously, surgical techniques have improved, but a large number of amputees still report suffering from a degree of pain from the missing limb. In a few instances, this might be due to a poorly fitting prosthetic, for example, or residual limb pain, but the majority of cases are harder to explain. And patients are reluctant to talk about it in case medical professionals doubt their mental state, so it's not very easy to say just how often it occurs. However, I still tend to think it's large numbers.
And you must have come across examples of this phantom limb syndrome in your own patients who have missing limbs.
Oh, yes, of course. Many patients report feeling as if the missing limb is still attached to their body, even years after the amputation. Some patients...
Yes. Question number 32. 7, 6, 5, 4, 3, 2, 1. Submit. Question number 32. Yes. Pass, share. And I'm giving you the answer here. Create a poll. Question number 32. A, B, and C. A, B, and C. And the question answer is so logical reasoning approach. So yes, that's it. So you can click copy post link, resume share, copy post link, and here is the way how you can find out the answer. Rajeshwari Sarvega joined today Telegram channel. Yeah, and this is copy message link. Yeah, anywhere you can go and apply the answer, and you'll know whether the answer is right or wrong. Then now submit, update your scores. Update your scores, please. Rajeshwari, 2 out of 2. Good. Yeah. So I have given 2 questions. I'm going to give you 2 questions. Afterwards, the session will be strictly for the regular students, because after the break of 10 minutes I'll give, and that will be only for the registered regular students. You can have your dinner and you can come back. We are going to do 4 more questions, plus afterwards we are going to learn reading part C. Reading part C. So the next session, the second part after the break, will be only for the registered regular students, because there are some more secrets that I have to explain, and those will not be on the YouTube. They will be only for the regular students on the Zoom. So try to attend the session. Do not miss that session after this explanation, please. Yeah. And those who are interested in the regular sessions, you can contact me. And this is my number. Contact the admin. This is my number. Copy link. You can contact me here. This is my WhatsApp contact. Yeah. Those who are really, really, really serious, and if your intention is to crack in the first attempt, then contact me. Yes. Right. Now here is the point. This is, now you updated the score. Now I'm going to give you the answer, explain the answer. What happened? Many students did not update. Okay, passive listeners are there. Okay, fine. No problem. So this is the, yes, 32. 32. Yeah. Yes, this is the question. And I'm taking you to the paragraph, which is here. Script is here. Script is here. This is it. Yes, sir. Here, who is this? Admission required for listening, reading, and writing. Okay, I'll get back to you. 918296648986. I'll get back to you. RRD. I don't know what is the short form. So I'll get back to you after the class, please. Yeah. So copy, take a snapshot. Yes. So here is the question. Is now go through that. Yes. Now here we are going to discuss now. Okay. So we'll see in two phases now. The first one is here. Right. Phantom limb. Phantom limb syndrome. Yes. Right. Imagination, imaginary. So how common is this? Yeah. Now you can see the answer from where it is coming. Okay, so forget about that. I'm taking you there now. One word, which is very, very important. And patience patients are reluctant to talk about it. Report. They're reluctant, not interested to talk about it. Reluctant. They don't share. They're adamant. They're not interested to share. Reluctant. They're not sharing. So it is underreporting. It is underreporting. About it. It what? Phantom limb. Okay. Right. So underreporting by patients. Okay. This might be, but the majority of cases are harder to explain. Harder to explain. Hard to know. If we know only, then we can explain, right? Okay. If we know only, we can explain. We don't know, how can we explain? They're hard. Okay. Harder to explain. Okay. Right. Often, frequent. It occurs, is. Okay. Try to understand. It's not very easy. Not very easy. Not easy. Not easy means hard. Not very easy means hard. Try to understand the point there. Not very easy means hard. Okay. So it's not very easy to say just how often. How. Try to understand the point there. I'm telling you every word. Okay. Every word is there. Every word is there for you. Now let me show that. Reporting. Talk. Okay. Hard. Not very easy. Okay. Not very easy. How. Frequent. Adverbs of frequency. I taught you yesterday. Often. It. Occurs. Is. No. Explain. To. Harder. Not very easy. Okay. So see that one. Patience. Reluctant. Not interested to talk. They are not interested to talk. So they are not reporting properly. So underreported. see it very clearly. So, question number 32. Question number 32. I hope once you analyze this question like this, it will be easy for you. Okay. It's very important for you to strike a parallel to each and every word which is given in the option. Okay. Right. So this is listening converted to reading. So you will know how the synonyms are working. Yeah. So 2 questions have been explained now. Go through these questions and try in the same way. Okay. Try in the same way. This session, this particular session of 2 questions is a demo session for the students to know what we are doing here. Right. So next, all the regular students, don't miss next session. It's very important. So before we leave the session, we go for dinner, and after 15 minutes, we'll take the session. And what we are going to do is get ready, have your dinner, and get back to me. I'll give you a new link to the registered students group. Don't share this link, and this link will not be on the YouTube. Many people think that the session will be on the YouTube. Sorry, they will not be on the YouTube. Only these open sessions will be there on the YouTube. So don't think that if you miss this session, you'll miss it. So now, I really appreciate the students who are seriously attending the session. And yes, I welcome you people. Simiat, Omar, Julia Esin, Ifat, and DK. These are our guests for today. So thank you for attending this session. Yes, and before all of you leave, you can give your valuable feedback for this session. And whenever we give links in the open groups, please attend. We are leaving 1 minute. Yeah. Simiat, are you a doctor or a nurse? We have only one nurse position now, and we have one doctor position. Either way, you can attend. Only one place is there. You are a nurse. Okay. The fees for doctors is 40,000 for 3 months and 25,000 for 1 month. But the fees for nurses is 25,000, 15,000 less because you get less paid than the doctors. So that's why I give some discount to the nurses. So you can contact me. I'll give you my number. So if this admission is done, the nurses admissions will be closed. Where is my contact? Yeah, just a second. Contact the admin. Yeah, here it is. Copy link. Just message me on my WhatsApp. Yeah, and I'll follow it up. So we are going for dinner, and after dinner, there's an exclusive session. Where we learn many other different techniques. I taught you only 2 techniques, that is transforming the audio into written script, that is listening simplified by bringing the script, making it reading, listening made to reading, listening converted to reading. That is one technique. And the technique is logical reasoning approach. 2 approaches I have taught you now. Then there are some more important approaches, that is inductive and deductive method, and known to unknown, simple to complex, easy to difficult, and general to specific techniques. That 4 techniques I'll teach you in the next session. Yes. See you again shortly. My name is Simiyar. I'm a nurse by profession. Yes, Simiyar, I got your message. So